Next, we're going to talk about how to go about teaching the goal that is on target. One method for doing this is discrete trial. Go ahead and find in your packet the discrete trial worksheet and read through it. I wanted to take time to highlight a few of the procedures within the discrete trial process. The SD, that is the environmental cue that would indicate how the child should respond in order to access reinforcement. The prompting stimulus, or a prompt or cue from the instructor in order for the child to respond correctly. The response is the skill to be learned. The reinforcing stimulus is the reward to motivate the child to respond and respond correctly. And the optional fifth, which is the inter-trial interval, a brief pause between trials. I would also add that as part of the SD, it's very important to gain student attention before delivering the SD so that you know that the SD is being attended to. Next, we're going to watch a clip of a discrete trial training procedure, and I'd like for you to identify the parts of the video where each of these procedures are being used. The video is very short, so feel free to rewind and watch it again so that you can practice most effectively.
All right. Hi, Mr. Vince. All right, hey, touch red. Good, that's touching red. All right. Hi, Mr. Vince. All right, hey, touch red. Good, that's touching red.
Another role of yours as an RBT is to understand how to fill out data sheets as well as prepare the data sheets for that week. Remember that the parts of a data sheet that you would want to be aware of are the SD, the response, the target name, and understanding what constitutes a trial. Remember that the SD is what the provider says or presents. The response is the behavior that the child does. The target name is the stimuli that you're using specifically to that goal. On this data sheet, all the trials are numbered 1 through 20, and you would take the trials horizontally. What constitutes a trial might change depending on the goal that you have in mind. A couple examples of common errors that I have seen as a supervisor is staff misunderstanding what constitutes a trial when completing a puzzle, sorting cards, and for manding. An example of when completing a puzzle would be done piece by piece is if you are trying to increase the amount of pieces a child does independently. For example, if the child is completing a 10-piece puzzle and you only take data on the puzzle as a whole, you might miss out on very pertinent information about which pieces or how many pieces were independent versus how many were not independent. An example I can think of when this would not be the case is If you were trying to extend the length of time a child was trying to complete a puzzle, or increasing their leisure skills, you might have them doing multiple tasks and a puzzle might be one of them. But instead of getting independence for each individual piece, you would just say if they did that puzzle without needing redirection or not. In that case, the puzzle as a whole would be an individual trial and you would only have one data point taken. Another common example I've seen is with sorting cards. If a child was trying to determine the difference between the colors yellow and red, and they had 6 cards of each color to sort into 2 separate piles, it would be very important to know the independence of each of those cards instead of the categories as a whole. There might be a case where this differs, so if you have questions, please contact your supervisor. Manding would also be an example where each trial is each time a child mans. Keep in mind that depending on the child, the goal that the supervisor had in mind, and the long-term outcome, what constitutes a trial might differ. This means that these examples are just to get you thinking about what exactly a trial is and how you should be implementing trials, not a hard and fast rule about specifically what trials are at all times.